Somewhere in the middle of 2013, I had what I now fondly refer to as my crazy, beautiful turning point. A moment when I was so arrested by an idea that I found so compelling that I just pushed fear aside and I dived right in. And you know, moments like that are waiting for all of us. But what preceded my crazy, beautiful turning point was one evening I pulled haphazardly from a deck of cards a question. And the question was, what one thing would you do if you didn't let fear stop you? And I thought about that for months. I thought, what would I do? What would I do if I didn't let fear get in the way? You see, I worked in healthcare, and so I knew that 15,000 people die every year in hospitals of preventable causes. Things like mismanagement, medical error, wrong label on a medication. I knew that clinical staff report that up to 40% of their time feels wasted on administria. And I knew that change wasn't going to come from the top. So what did I do? I resigned. That's right. I handed him a notice. And the day I arrived at work, which we can all now refer to as Resignation Day, I pulled out my security pass and I swiped the door to get inside, and I swear to you, as if my life were a musical, I heard Bob Dylan sing, "We Shall Be Released." Go figure. That's got to be a sign. So what came next? Well, what came next could never have been predicted. You couldn't really orchestrate something that you later call a crazy, beautiful turning point. So what came next was I decided to create a social movement, and I developed a digital platform called Change Day Australia. And it's really, really simple, because what I do is I ask people who work in health and social care, I say to them, what is one thing that you could do that would make a difference for your patients and your clients? What is one thing that you could do where you could be amazing without even waiting for permission? Now, I can't lie to you. That first year with Change Day Australia was really hard. We developed that first little website at 2 a.m. in the morning, a couple of MacBooks, some beers, and we were off. Some days I felt like I was lost in a maze. I felt like I was blindfolded. And I'm going to be deadly honest, some days I felt completely terrified. You see, you don't get to disrupt the way improvement is made in the healthcare system without copping a little bit of heat. But they weren't all bad days, because once I launched Change Day Australia, something quite extraordinary happened. People started logging on. First just a few, and then hundreds, and people started making pledges. They started making pledges to do things that were really quite extraordinary. They said, I'm really going to show up, and I'm going to do something that makes a difference. And first it was just tens, and then hundreds, and then thousands. And before I knew it, in that first year, we had raised 15,000 pledges across Australia from people who work in health and social care, saying, you know what, I can be the change. We'd run that first year entirely on my savings. So at this stage, I'm dead broke. I've put everything I've got, I've emptied my pockets, it's all on the table. So in the second year, I crowdfunded, raised a little bit of money, And I kept going. And then you know what happened in the second year? 56,000 people made pledges. This is the largest grassroots quality improvement effort that we have ever had in Australia. And I learnt so much. But I want to tell you 3 things that I learnt that will stay with me forever. The first is, we really do have what it takes to make a difference. We can push through those enormous barriers and obstacles and create a much better world. I know we don't all think we have what it takes, and we don't all think that we can reach that wonderful potential. But we can. I'm not saying your idea has to be lucrative. It doesn't even have to be sustainable. It just has to make a difference. But we've got to marshal all our courage in order to be able to do that. The second thing I learned was you've got to find your tribe. And I found my tribe through crowdfunding. And you'll have your own way of finding your tribe. And when I talk about a tribe, I don't mean people who look like you. I don't mean people who think like you. I mean people who want the same things for the world that you do. And they're out there. And they want to cheer for you. They actually want you to hack a way through and create a path to something quite extraordinary. And they're going to help you. And when you find your tribe, hold on to them. Hold on to them. The third thing I learned was no matter how frightening and terrifying it is, we have to embrace a world that is about connection with each other. We need to create a world where we value and revere the connections that we share with our colleagues, with the people we deliver services to, the people we work with and care for. You know, health professionals occupy a really privileged space because we get to meet with people right at the edge of the human predicament. And I've been in that intersection of human emotions many, many times, as many of you have. And when you're at that space, it takes courage and it takes a great deal of open-heartedness. And the world that we want to create, which is about purpose and connection, will see kindness and respect as something so important. You know, the thing is, once you tap into that, you discover this kind of wellspring of joy, and it delivers for you meaning and purpose in the work that you do. And you know why that's so important? Because we really don't have any choice. We are the change that we're all waiting for.